Hello folks, Rohny here. First, I must begin this video with a medical disclaimer. Ladies and gentlemen, please remember that I am not a medical practitioner, so consult a licensed health care provider for personal advice, as individual responses to these exercises and stretches can vary, and as to whether or not you should be doing them for your conditions. This video and audio is just a demonstration of what I do for myself to uncrinkle my spine and reduce pain, with my belief that there are different relationships between areas of the spine, so that where the pain is felt might not be the place that needs uncrinkling. Also, I've only put this set of approximately 13 exercises, stretches together in the last 4 months, so it is yet in the beta stage, so changes in the routine could be made in the future. My talkings and groans during the exercise refer to what I am doing for me only, and you may have to make some adjustments for yourself so you do not injure yourself and make things worse. I use these exercises for my pains and headaches, for my chronic pain, osteoarthritis, osteophyte, spinal stenosis, for the whole range of my back and hips, with some emphasis on an unstable neck, and find it necessary to do every morning as soon as I get out of bed. First, we start off this way. Now, first put some elbow into the knee, but don't put pressure on the right knee for me, because I've had some injuries there before, and I try to rise up and really feel it under the hip, the buttocks, and then this is the only time that I do not keep a slightly tucked chin, is when I come forward and come forward. Oh, wow. This is the noise I make every morning. All right. Let me try to rise up again. All right, next. Come over here. Excuse the signals to my videographer there, Miss Jojo. Get her in the right angle. Now, this is important here. I am lifting up, and I'm using my fist to help push myself up and lift up, and then try to turn a little bit. I can't turn too far on my right, so don't overforce it. And just a sec, even I make a mistake the odd time. I did not cross my legs. Okay, get those legs. Videography, see the way I cross them? All right, now I'll do it. Come across like that, pretty close in with the right fist. And then you go back again with the hand a little bit further away. And on these exercises, you can do pushback too. Get to the end. Oh, good crink in my neck. So, pop. And then I do click back, push back here. All right, now I make the dive. Oh, there goes a nice crank in my neck. Now, straight out. Some more nice crinks. Higher spine. Feel it in my hips. And I go out with the left arm a little bit. Get a little more on my right hip, left hip. It's all there, and then push up. Now we'll do the exact same set on the left side. Okay. Well, ladies and gentlemen, we skipped over the left side just to save some time, but the final dive, when I come out of it, again, I try to do it straight, and then I turn my right elbow out here. And then when I come out of this twist on the left side, my breathing is very much released. I breathe a lot easier right now. Now, from there, we do some good stuff for the neck, and it also requires a fallback. Here we go. Two fists together, get comfortable there, and push like heck. At the same time, allow your body really good posture. Pull up, push up. May not hear a crank right away, but you can feel those tendons on the neck stretch up. And then I fall back and I get some cranks and pops when I do that. Now, when I do this on the edge of my bed, I'm higher up and sometimes have trouble getting my feet on the ground. So I have to wait. Sometimes I do a little bit of a tuck to put more stretch into my lower back. And then I'll sometimes just sit here for a minute or so, but I won't today for purposes of video. And then be careful when you get up. I just put my elbows. And sometimes when I'm on a higher bed, I have to lift my feet a little bit to help me up. All right, and in that one, my right hip is raised up a little, so lately it hasn't been bad. My right foot gets to the ground, but I have to give it a kick out sometimes, not too rough a kick. All right, now we're coming near the end. There's just one more, a couple more. I also do this up here with the elbows up and rise up just about nipple high here. Depends where your nipples are. And I push like heck. And this really, really stretches those two tendons on either side of the neck into the head. And that part's done. Now this part here is a little tricky. You can probably do both sides, but I happen to be, I'll call myself an expert in kinesiology, finger kinesiology. So I usually check and ask my body what side it goes. So here, I just ask in my head, left, right, left. If it wants to go left, it's the usual side for me. Be different for you probably. It can be, but in doubt, do both. You can learn about kinesiology with fingertips just on Copilot. Copilot will tell you most anything. All right. So I push to the left. Oh, I get some nice cranks in there. Oh. And then I'm done. Thanks for watching. Happy spine, folks.